Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders, viewable on M. Oppenheim TV and YouTube. I'm your host, Mark Oppenheim. Today, as part of our ongoing series on homelessness in America, we're chatting with leaders of Project Renewal in New York, including Eric Rosenbaum, President and CEO, and Shams DaBaron, board member and activist. So thank you both for joining us. This is such an important topic all over the United States. We find people who, in different circumstances in different cities, are housing insecure, are homeless, require temporary shelter. So I really would love to jump into what you're actually doing to address these very human problems. And starting with you, Eric, I'm looking at your offerings, and your offerings for the unhoused seems to take a very holistic approach. It starts with homes, then it goes into health, and then it goes into jobs. Right? So talk about this idea of treating the whole problem as opposed to just providing a point solution.
Sure, and thank you for inviting us to have this conversation with you. There might be an idea that someone becomes unhoused because they get evicted from an apartment and they can't afford to pay the rent. And so all we really need to do is to help them find a new apartment or a new home. And for people like in California who are just being displaced by these huge forest fires, that is an important cause of homelessness. But for the work that we do at Project Renewal, we're working with people whose homelessness has evolved over years, if not decades. They didn't just become homeless because of the last eviction. For many of our clients, it started in childhood when their parents were homeless. And if you're homeless as a child, that means that you're moving from school to school to school and missing school. So you don't have the educational opportunities you need to be able to get a good job and pay the rent as an adult. And along the way, that kind of housing instability also creates the conditions for mental illness, for substance use, for becoming engaged in the criminal justice system. So by the time our clients come to us, they are not just homeless, and simply giving them an apartment doesn't set them up to be successful in that apartment. So if we don't address the whole person and the traumas that they have experienced along the way, we're not doing our job. We're not helping that person achieve the independence that they deserve and that they want.
When you look at your own experience, and please describe from your perspective, your experience of what Eric is talking about, because if you haven't actually lived that life of housing insecurity, you're like I am working within a theoretical construct, learning from people who have actually experienced it. Tell us how you see this idea of being housing insecure and how you've experienced it.
Well, for me, I have this history of having been a part of the foster care system since the age of 2. So moving from place to place, not having a stable home was sort of like that was my background growing up as a young child. And having started to experience homelessness at the age of 10 and being permanently discharged into the streets from the foster care agency at the age of 12, chronic homelessness has been a reality of my life. But it's also something that visited itself upon my children. So it passed on through generations. And I think when I really do the deep dive into my family's history, you see patterns of that. You see patterns of addiction. So I often go back, especially for when I look at New York City in particular, and why we have homelessness and why there's housing insecurity. I have to go all the way back to slavery and start to bring how America addresses groups, starting with Black people, but also with immigrant communities that have come since and stuff. So there's this big wealth inequality and all these other things. So we haven't solved those issues from generation to generation. And I basically inherited a lot of this stuff and wasn't in a position to sort of change it at certain points in times in my life. So my kids experienced it as well. The actual experience is just as Eric described it. It is an experience that, I was an academic star. I helped to develop hip hop culture. I have all these great things about me, but without a stable home, it's extremely difficult. Then, the trauma of being a parent, trying to do the right thing, but being forced to be, well, not forced, but being in a situation where I had to be in family shelters, having my son age out, trying to prevent him from sleeping on the streets, having to go on the streets. You start to realize, even though I figured out all the survival mechanisms, and I don't want to say I figured it out, but it came to a point where I couldn't avoid the fact that it was having a negative impact on my physical health, a negative impact on my mental health. And with me being in the streets, I described my story as having, prior to entering Project Renewal shelter, being so tired with this lifelong experience that I wanted to end my life. And fortunately, I ended up, in previous shelters I've been in, there was no on-site support. So I didn't know the difference at that time because that was my own experience. You get the bed, you get the three hots, the three hots, the cot, and the locker, and the roof. And that was it. So when I went into the streets in an attempt to regain some type of sense of dignity, believe it or not, I just descended even more. And it wasn't until entering into the Project Renewal shelter that I was able to attach to mental health support. I was able to treat my alcohol problem, and then started to understand what treatment looks like, what therapeutic help looks like, what physical, like just medical help looks like, and was able to destabilize from that point. But in retrospect and reflecting on that, I now see how chronic homelessness, or even, coming out of that, you still have the trauma of that experience. So as Eric said, you get your keys, you get your apartment. That doesn't necessarily erase the decades of that experience. So trying to find, creative ways or better ways to address those things is extremely important. And that's why I continue to do the work that I do, using my lived experience to try to share and help people understand better, what the reality of that experience is like.
The thing that strikes me is that human beings are learning, adaptable machines. There are skills that you've accumulated to survive the foster care system, to survive living on the streets, that if I were thrown out onto the streets without anybody to call, without any place where I could couch surf, you could teach me how to navigate. And I would have to really go to school. It would take me years to learn what you know. And I know things that you don't know. And it's the same thing that you're describing with Project Renewal. You had expertise, but that expertise would only, if you exercise that expertise, it would only bring you back to the streets because you knew how to survive the streets. Now you had to learn how to survive not in the streets. And you say, the key, what do I do now? And that's where, Eric, you talk about health, mental and physical health, and then you talk about what happens next, right? How do you relate with family members? How do you relate with others? How do you show up for a job, being there on time? There are different skill sets. Those things, if we who have lived that life take that for granted, just as somebody living on the street sham would take for granted knowing how to navigate there, they're just skill sets. And sometimes you need help to learn a different skill, right, Eric?
Absolutely. And in the 57 or 58 years since Project Renewal was founded, we focused on this core population that we serve of individuals who are not just experiencing homelessness, but who have these very often co-occurring challenges of mental illness and substance use and criminal justice and racism. And what we've been able to build in this time is an interlocking system of therapeutic and social work and physical interventions that work together. So we have shelter. We have a support and connection center that is explicitly designed to work with the police around people who are on the streets and misbehaving, but not really breaking the law. We have transitional housing for people who are coming out of prison and need a particular type of support, or have severe mental illnesses and need incredibly supportive environments to help them be ready for more independence. Yes?
Eric, I just want you to use a different word besides misbehaving. If you don't mind me interjecting, I couldn't let that one go.
Okay, I'll take, give me a better word.
Wait a second, let's talk about that. When I interact with people in different environments, there are different norms of behavior. There's different language that is used. If I'm in Amarillo, Texas, or Canyon, Texas, where I've done work, or if I'm in Anchorage, Alaska, or if I'm in Queens, or if I'm in downtown Manhattan, I'm using different behaviors because I connect to people. And what you're saying, Shams, is that sometimes you have two people connecting and they create a barrier because one is saying that's misbehavior, right? And the other is not necessarily connecting with them. And so part of this is meeting somebody in between, figuring out a way to interact so that there can be an exchange, right, Shams?
Yes, and I think Eric understands that when meeting people where they're at, it's really also looking at them as the human being. And, what might be deemed as, misbehavior might actually be something else. And so we have to be careful with narrative and words and language because, that's how in many cases we get a wrong diagnosis. And how can you solve the problem if you don't see it through the right lens? And one of the best ways to find a way to deal with it properly, a lot of time, and what I experienced at Project Renewal, was someone not looking at me as the alcoholic, someone not looking at me as the homeless guy, even although I was actually homeless, but someone just looking at me as a human being and centering me in that power. And then speaking to me and addressing me and uplifting me with that power. And that is what I move on. I embrace that. And it's easier for me to see myself as being more than homeless or whatever. And that's why I use the term I'm the hero or whatever the case is. And I know Eric, he knows this, so I just wanted to make sure.
The other thing, Eric, is that you're creating an organization and you yourself modeling this, and you just did, of listening to what the other person is contributing, not necessarily accepting everything that the other person says. I'm sure you and Shams have your disagreements, about strategy and so on and so forth, right? Sometimes?
Not so much.
Okay, but
no, we agree in basically everything. Eric is and that's why I can interject like that, because one thing with Eric, and I want you to get this, Mark, is that he does listen, he does hear, and he doesn't impose. And so it's easier for me, and this has always been our discourse, even when I was a resident. He's always been open to well, teach me, show me, and let me know. And it wasn't about what his professional view was or his educated or theoretic view was. It was like, I know you're the expert, so okay, all right, let's go. And I think that is the beauty of Eric and his leadership, number one, but also in the beauty of what Project Renewal represents and how it was able to impact me in a way that, say, some of the other places I've been weren't able to impact me, if I could say it.
So, Eric, this isn't all sweetness and light, right? Talk about creating an organization that is able to walk that fine line between providing service, providing respect, and so on and so forth. But there's a piece of this. You have to be tough financially. You have to be tough in terms of behaviors that you expect. Talk a little bit about that fine line between being tough and also being open and listening.
So if I think about this from the standpoint of the individuals that we're working with, one of the greatest challenges is that not all of the people we work with are thrilled to be with us. They don't want to be in shelter. They don't want to be in treatment for mental illness or substance use. But they find themselves in this position. To be successful, as Sham says, we have to meet people where they are. But that can be really challenging because sometimes where people are is angry, is resentful, is not really wanting to be helped at the surface. They want to be helped, but they don't want to be helped, like in the way in which we're trying to help them. And so the magic of this work occurs when all of our services are available to someone at the very moment when they are open to and willing to be engaged with them. And sometimes we have to wait years for that. What I love about us is that we have the patience to be that way, and that we work to bring together the services in a way that makes them easily accessible to the individual. What I mean by that is, think about medical care, psychiatry, substance use treatment, occupational therapy, social work. You have all of these services, each one of which has its own licensure requirements, and the best practices don't always align perfectly. So our great challenge and our great opportunity is to create an organization in which these services really work together, but they are centered around what are the goals of the individual that we're trying to help. To actually ask that person what success looks like for them, and to help them engage with what we can do in such a way that it is directed by them, for them, because that's probably the only way in which it's really going to stick.
And it's such an important point, right? This idea of agency, because you're interacting with people who have not had agency. They don't get to pick. And when you're asking for help, you are giving up power, but if you get to determine what kind of help you need, you can also acquire power. That idea of helping people who are ready to take control, but also cede control. It's that very sensitive balance, right, Shams? I mean, you don't want help from certain people if they're not willing to understand that it's you who are the decider.
So I love this conversation, and both of you centered this really good. So if I've spent a lifetime and I've met so many people, it doesn't have to be my experience, someone going through the criminal justice system, et cetera, right? If most of my experience have been what I perceive to be failures of the systems, and however I frame that, of course, even if you're offering me a lifeline, I'm going to look at you and say, I don't trust you. I don't want it. And I say to people, if even when I was contemplating suicide on that park bench that I slept on, if you came to me offering me the Waldorf Astoria, I would have told you to kick rocks, right? So I ended up in a situation where I was sort of forced to stay in the shelter. The pandemic happened. There was nowhere else to go. And I felt like, oh, let me make this bad situation a little better, because they were serving great donuts and bagels and coffee in the recovery center, in the TRC that Project Renewal had, where they had the health component and all those other services. So I said, I'm here, let me take part. I didn't want any of that stuff. I didn't even know what it was. And truthfully, if you would have told me I had a problem, I would have told you, no, I don't. You don't know me, right? But once I got treated a nice way and was able to open up a little and start to gain some trust. I opened up more. I received the services. Then I started to understand what help looks like, and I started to trust more. And it literally transformed me in a way that I can confidently go back into communities, into the streets, and tell people, hey, I know what help looks like. And even those who are able to administer the help, to be able to show them how to make that connection in a way that sort of makes sense to the person that's be in distress and stuff.
No, I get what you're meaning. I want to ask you a question about this combination of failures, because it seems to me that there are two types of failures. There's a systems failure, and you've referred to that a number of times, but there's also a personal failure. How do you work your way away from a systems failure, and this is for both of you, and the personal failure, so that you end up with a personal success, or a series of personal successes, and a series of systems successes? Because I think they come hand in glove. Systems are made out of people. So where's the failure?
System failures, I think, are clear. Bad policy, lack of... A two-year-old going into foster care and being jettisoned at 10 or 12, right? That is, yeah. I mean... That's a system failure.
That's a freaking system. That's my failure. I'm part of the system. It's my failure.
Now, the person failure depends on who you're talking about and what you're talking about. That can be a little tricky, because if systems are not set up properly to actually center human beings as human beings, then it's not necessarily the burden of the person as much as it is on the system. And we have systems that traditionally have not worked for poor people, have not worked for people, especially minorities, and those are systemic things that have been bad since the founding of the country. And so what we have to do is get into those systems and start to change those systems with the understanding that the human being who's impacted by those things, those laws, those policies, et cetera, those human beings are extremely important. If the policy put the human being over the profit, you would have a better person.
My thesis, Eric, is that we're all part of the system. Those who are served and those who serve.
Well, every Monday morning, I meet with the new employees at Project Renewal. And I talk to them about the history of homelessness. And part of what I ask is, why do we describe homelessness as a crisis? Because the definition of a crisis is something you couldn't see coming. You don't know what the solution is. It's chaotic. And yet this has been developing for generations. We do know what the solutions are. Provide the housing that people need. And so it is interesting that we frame this as a crisis when it is a series, as you describe, of system failures. But the interesting thing is that from the vantage point of an individual, nobody will ever care as much about my future as I do. And no system of support can be effective in helping someone if that person doesn't find the germ of desire to make their own better future also. And then you can have a partnership. This is really important. You can provide all of the services, but if the individual doesn't want to engage, it won't be effective. One of the great challenges right now, the debate about people who are mentally ill on the streets and who are dangerous. What do we do with them? Do we lock them up against their will? And the problem in framing it just that way is that, of course, we have a right to public safety, and people who are dangerous cannot be simply allowed to be dangerous. But at the same time, we can't lock everybody up. And even if we do lock them up, at some point they're going to be released. And the question is, will they be released in a way in which they are fundamentally changed and willing and able to function? And are we engaging with them in such a way that they can do that? And so framing it as the either or of we do nothing and allow them to be on the streets, or we lock them up in institutions that have historically proven to not really be so helpful, isn't helping us. The system has to evolve. We have to provide a range of options that actually do meet the needs of the people without treating it as one size fits all. And we also need to engage that individual in such a way that they attach to the thing that will make them want to be a part of this, to a part of their own independence.
Can I add on just a little bit? So, and Eric, you brought up something really good. For me, it's like, when you give me a good environment, it allows me to sort of, and I describe that process of being the mentally ill person who is angry, who wants to kill himself, short of hurting someone else. What would make me change? And the thing that made me change is I went into a different type of environment. I was treated in a different type of way. And I've experienced dealing with some people dealing with serious traumas and serious mental illness. I'm always in the streets helping these people get into safe havens and other places. And how do I connect with them? How do I get to them when they might be going through, for lack of better words, a psychosis, or they might have a moment? How do I connect? How do I get them to calm down and to trust me? And really, sometimes it's just showing enough caring without putting myself in danger or endangering them, that they sort of, but it's a process, and it doesn't work all the time, and it doesn't work in a moment. But there is a way to do that. But the other end of that is just what Eric is saying, is that you have to create environments that helps to support that. And that's not an environment that's necessarily going to be a jail cell or a step down from a jail cell. It has to be something that does answer to the person's needs, and everybody's needs are different. My mental illness at that time was not the same as someone else's who might really been, just looking to hurt somebody or hurt themselves in a different type of way. And so it's like the idea of meeting people where they're at, but also making sure that the systems work for them as individuals. That's where I was centering the human aspect of things. If we're looking at the person and we design policies and environments and housing and those things, even shelters, in a way that takes that human being into consideration and answer to their needs holistically, we begin to create an environment where you could help even the most troubled amongst us.
The thing that strikes me is, as you're each talking, is that there's a little bit of help across divide of expertise, lived experience, but it's bi-directional. It goes both ways. That's why what you have at Project Renewal works. You're shaping what you have based on the experiences of people who have been there. And those people who have been there are ready to not only receive, but to contribute, right? When you get to that point where people have agency, which is what you talked about, Eric, about people being ready, what you've talked about, Shams, right? Then that exchange can happen. It cannot be forced, right? It must be free, and it must be respectful. To me, that's what we've modeled here. Just listening to you both, it could be any of us in any role. And indeed, that's what you've got right now, Shams, right? That's what you've got right now, Eric. You're basically learning from each other and then maneuvering. Let's just, before we come to our end, I'd like you each, starting with you, Eric, and then Shams, if you could comment, talk about the range of different services so that we do talk about the different services. And Shams, if you could talk about as a board member, you're a fiduciary. You're responsible for this organization's financial strength. You cannot afford as a board member to have the organization want to just sort of blithely throw out resources in a desperate attempt and weaken itself, right? So I'd like you to comment on that, sort of the fiduciary responsibility as a board member, because that's a considerable move. But Eric, could you talk a little bit about the kinds of services, the practical services that you provide?
So we really do provide a continuum of services. So the Support and Connection Center is a small little facility with 16 beds and a 5 or 10-day stay. But we also have 7 city-funded homeless shelters that house almost 5% of the individuals who are in a shelter every night in New York City. These are shelters that are specialized, including the city's only shelter for LGBTQ young adults aged 18 to 35, shelters that are specialized to work with people who have mental illnesses or substance use disorders. As I said, we have transitional housing, which is intended to be for 1 to 3 years so that there's stability in an independent apartment to get someone ready for permanent housing. And then we have a permanent, supported, and affordable housing. Supported housing is a model where each person has their own apartment, they're a tenant, but there are services on site to help them make sure that they are stable and that when they need particular help, that we're there to provide that help. Then around all of this housing, we're a federally qualified health center. So we provide primary care, psychiatry, medical substance use treatment, and access to a whole range of other disciplines, medical disciplines. We have, I think, 50 nurses on staff. We are a workforce development agency. So we have specialized trainings that help people who have lived experience in our housing or in our shelter gain access to careers in human services where their lived experience is actually a competency, or in culinary arts where they can either go form their own restaurant or work in food service, institutional, or events. We are one of the largest occupational therapy programs in the country. Occupational therapy helps people manage the skills of daily living. Again, we think about giving someone a key to an apartment and expecting them to know how to clean the apartment, what to do when a toilet gets plugged, how to cook for themselves, how to shop for themselves, how to budget to make sure that you're paying the rent or the electricity every month. These are skills that we build through occupational therapy. We have specialties around people who are aging in place, bringing them out into community, helping them avoid the social isolation that often comes with the challenges our clients face. And to the question you posed to Shams, part of what's special about us is that there's no one funder that supports all of this. Most of the healthcare is funded by the federal government. The shelter is funded by city government. The permanent housing is mostly often funded by the state. There's private philanthropy that really helped us build our occupational therapy function. So part of what we do is bring all of these different funding sources, all of these different licensures together around the mission that we serve. And that actually helps with fiscal stability as well as program success.
You function as part of the fabric of the city.
Mm-hmm.
Shams, how do you ensure that this organization remains financially strong and operationally strong in service to this mission?
So I have a unique position here in the city in that I also assist the city with addressing the issues of housing and homelessness in a proactive and workable, sustainable way. And by doing that, I'm able to sort of understand where things should go and where they shouldn't go, measured with my lived experience and my engagement with people that are continuously, at this point, struggling and in need of services. So coming and working within the context of Project Renewal on their board, and this was what you were getting at, being able to create the right balance between, the lived experience of Shams of we need this, we need that, I want this and I want that, with the balance of, wait, we got to manage this properly so that if we're doing this, the metrics are being met, that yes, the people are being served, but the organization is able to function. So, and I maybe Eric might have to chime in again, but I sort of say, okay, from my lived experience and my work through the city, I'm understanding that housing is the solution to homelessness. I don't want to see the expansion of a shelter industrial complex when in these spaces we might need more housing and maybe a different, better type of shelter. So I say to Project Renewal, where do we look like? What does our future look like in terms of producing more housing? And also, what do we look like in terms of the services that we're providing? So when you look at things, and this is what matters to me more than anything, how is it actually impacting the person? What are we producing? When I see the workers who are coming out of the workforce development, when I see the City Beats workers that are now working in fancy restaurants, when I see the people that I once shared space with in the dormitory style shelters who are now social workers, who are now therapists, who are now on the pathway towards being educated, I know that the money is being spent in a way that is actually producing the result for those people that is sustainable, that is not going to see them continue in the cycle of poverty, dependence, addiction, and mental illness without proper treatment, without being able to manage it. And it's a unique position, but I think, if I can self-plug, I think one of Eric's greatest things was allowing me to be a part of the board.
Shams is actually true. And what he hasn't spoken about is how he has become a senior advisor to the highest levels of city administration around these issues. Shams has been appointed to the Charter Revision Commission. And so he has a credibility, both from his lived experience, but also from who he is and his thoughtfulness and his ability to think from a systemic standpoint, that has enabled him to be a real bridge between government and us and people with lived experience.
This is a really important point. If we listen and we see people as people, and we get out of our own way, you have found a way to connect with somebody like Eric and other people in the city. But there are other people with this type of expertise that might not have found that way, that are worthy of voice and worthy of being listened to, right? And what you basically said is you have unique ability, along with others who have experienced what you've experienced, learned what you've learned, to ensure that services are optimized, that investments, because money is not infinite, that investments are wisely undertaken to address the long-term problems. So if we just listened and if we just partnered with people who know more than us, we might be closer to solutions. I want to thank you both, representatives of Project Renewal, Eric Rosenbaum, President and CEO, and Shams DaBaron, board member and activist, for sharing your expertise with us. Thank you so much for helping me to become a little bit more aware, a little bit smarter in this field. And please thank all of your people, every single person, every single client who is part of this systemic solution to a systemic issue. Everybody is joining hands. It's not all sweetness and light, I know, but everybody is part of this. And I want to thank you so much for sharing your insights with us today.
Thank you. Thank you for inviting us to be here.